Welcome to the another video of Basic Pathology Unit 3, first video, Infection and Inflammation. 1. Causative organisms and types in infection and inflammation. Infections are caused by different microorganisms, and the types of infection depend on the organism involved. Organism type examples: disease. Bacteria Staphylococcus aureus, Escherichia coli, pneumonia, UTI. Viruses: influenza virus, HIV, flu, AIDS. Fungi: Candida albicans, Aspergillus candidiasis, Aspergillosis. Protozoa: Plasmodium falciparum, Entamoeba histolytica, malaria, amoebiasis. Helminths: Ascaris lumbricoides, Ascariasis, worm infection. Prions: misfolded proteins, Creutzfeldt-Jakob disease. Types of inflammation depend on the cause and response. Acute versus chronic inflammation. Suppurative, pus-forming, granulomatous, fibrinous, serous types. 2. Terminology used in benign clinical interpretation. Term meaning: atrophy, shrinkage in the size of the cell, tissue, or organ, e.g., muscle wasting. Hypertrophy, increase in cell size leading to larger organ size, e.g., heart muscle and hypertension. Hyperplasia, increase in the number of cells, e.g., endometrial hyperplasia. Metaplasia, reversible replacement of one mature cell type by another, e.g., smoking changes bronchial epithelium. Necrosis, unplanned cell death causing inflammation, e.g., myocardial infarction, tissue death. Apoptosis, programmed, planned, cell death without inflammation. Hypoxia, lack of oxygen supply to tissues. Ischemia, reduced blood flow causing hypoxia, e.g., in coronary artery disease. Edema, excess fluid accumulation in tissues. Exudates, fluid rich in protein and cells, usually due to inflammation, e.g., pus. Transudates, fluid with low protein content, usually due to imbalance in hydrostatic or oncotic pressure, e.g., in heart failure. 3. Laboratory investigations and interpretation. Test purpose example interpretation. CBC, complete blood count, check WBC, RBC, platelets. WBC equals infection or inflammation. CRP, C-reactive protein, detects inflammation. High CRP equals active inflammation. ESR, erythrocyte sedimentation rate, measures inflammation speed. High ESR equals chronic inflammation. Blood cultures identify bacteria/fungi in blood. Positive culture equals sepsis. Urine culture detect urinary tract infections. Growth of E. coli common. Wound swab find organism in infected wounds. Guides antibiotic therapy. Liver function tests, LFTs, liver damage in infection, e.g., hepatitis, elevated liver enzymes. Pus culture and sensitivity find causative organism and antibiotic sensitivity helps targeted treatment. 4. Immunological investigations. Test purpose. ANA, antinuclear antibody, screening for autoimmune diseases like lupus. RF, rheumatoid factor, detect rheumatoid arthritis. HIV antibody test detects HIV infection. ELISA, enzyme-linked immunosorbent assay, detects antibodies or antigens, e.g., hepatitis, dengue. Western blot confirmatory test for HIV. Immunoglobulin levels, IgG, IgA, IgM, etc. Evaluate immune system status. Tuberculin skin test, MAN2 test, detect exposure to Mycobacterium tuberculosis. Flow cytometry analysis of immune cells, e.g., CD4 count in HIV. MCQs. 1. Which of the following organisms is a bacterium? A. Influenza virus. B. Candida albicans. C. Staphylococcus aureus. D. Plasmodium falciparum. Answer: C. 2. Which term refers to an increase in cell size? A. Atrophy. B. Hyperplasia. C. Hypertrophy. D. Metaplasia. Answer: C. 3. Which type of fluid is rich in protein and inflammatory cells? A. Transudate. B. Exudate. C. Plasma. D. Serum. Answer, B. 4. The programmed death of cells without inflammation is called A. Necrosis. B. Apoptosis. C. Atrophy. D. Hyperplasia. Answer, B. 5. Which of the following is not a causative organism of infection? A. Prions. B. Bacteria. C. Metals. D. Virus. Answer, C. 6. A positive blood culture indicates A. Anemia. B. Leukemia. C. Bacteremia. D. Thrombocytopenia. Answer, C. 7. Which test is used to measure inflammation by detecting C-reactive protein? A. ESR. B. CRP. C. CBC. D. WBC count. Answer, B. 8. A reduction in blood flow to tissues is known as A. Hypoxia. B. Ischemia. C. Necrosis. D. Edema. Answer, B. 9. Which microorganism causes malaria? A. Virus. B. Bacteria. C. Protozoa. D. Fungi. Answer, C. 10. The replacement of one mature cell type with another is called A. Hyperplasia. B. Metaplasia. C. Hypertrophy. D. Necrosis. Answer, B. 11. Which test is used for diagnosing HIV infection? A. ANA. B. RF. C. ELISA. D. ESR. Answer, C. 12. Edema is defined as A. Cell death. B. Lack of oxygen. C. Fluid accumulation in tissues. D. Increased blood flow. Answer, C. 13. Which term describes tissue death due to lack of blood supply? A. Atrophy. B. Necrosis. C. Hyperplasia. D. Hypoxia. Answer, B. 14. A low-protein fluid, usually due to increased hydrostatic pressure, is called A. Exudate. B. Plasma. C. Transudate. D. Pus. Answer, C. 15. Which investigation measures the speed at which RBCs settle in a tube? A. CRP. B. CBC. C. ESR. D. ELISA. Answer, C. 16. In acute inflammation, the predominant cell type is A. Neutrophil. B. Lymphocyte. C. Eosinophil. D. Basophil. Answer, A. 17. Which of the following is a fungal infection? A. Tuberculosis. B. Candidiasis. C. Influenza. D. Malaria. Answer, B. 18. Hypoxia can result from all except A. Ischemia. B. Anemia. C. Carbon monoxide poisoning. D. Hyperplasia. Answer, D. 19. Which of the following is an autoimmune marker test? A. Blood culture. B. ANA. C. CBC. D. LFT. Answer, B. If you are watching the video till now, then it means you liked the video. Please subscribe the channel and help channel grow. Also share with your friends. Let's make 1K. Thank you. 20. Apoptosis is important in A. Infection spreading. B. Tissue remodeling. C. Formation of pus. D. Necrosis. Answer, B. If you